This is a really important part of the shift, I think, that's happening in the trauma-informed care field, which is that the old model, I call it the medical model, is really about treating symptoms. And it's typically therapist-directed. It's short-term. People have a diagnosis. They're given some kind of a 6 or 8 session things where they work very specifically on this problem. It tends to be more cognitive and behavioral. And the goal really is that when the client leaves in the short-term therapy that they have, that they're able to cope better with whatever the stressors are in their life and some reduction in the symptoms of their trauma. People who go through our traditional behavioral health care systems multiple times, so they come in, they have short-term treatment, they go out, and they're okay for a while, but then they kind of lose ground, they come back in, they go through another round, and after 6 or 8 or 10 of these kind of sessions, people begin to think, you know, there's something wrong with me. I keep going and I'm not getting better. So what they do is they devalue themselves. They decide that they are so broken that the system can't fix them. And then they stop getting treatment, and some of them who really need meds aren't getting there. But they end up, it affects their sense of self. So they feel flogged, they feel broken and powerless. And so these are people who then, you know, their main recourse is to turn to some kind of addiction. But they're not looking at what's wrong with the system. So that's part of what I'm trying to show here, is that the old system just was a Band-Aid. And after enough Band-Aids, people get discouraged. So in the healing paradigm, it's quite different. And this is where trauma-informed care is moving us. They want us to be more attachment and client-centered. It doesn't really matter if it's short-term or long-term. People come, when they've had enough, they leave, and they use the resources that they learned until they get to a place where they realize they need more tools, and then they can come back. But the emphasis is always on what happened and what didn't happen. Because if we don't ask what didn't happen, we won't get to the neglect. And the neglect is so big in our culture. The healing model is much more heartful, and we are really going to talk about the role of the heart in this training and how our heartful interactions with our clients are really part of the way that our clients can change their brains and their nervous systems and their behavior patterns. So it's very therapist-client oriented. And what we're looking at is what's the source of the problem? Because we don't want to keep putting on Band-Aids. Band-Aids just are too expensive. And once we can identify a client's trauma and make meaning of it, it shifts the context in a way that really helps them to heal. So our approach is really integrated. It includes mind, body, and spirit. And what we're looking for is transformation, not Band-Aid. A transformation, meaning that the person makes a change. So you see how different these two paradigms are? The question is, where do you learn about the healing paradigm? Who do you go to? I mean, there are some very specific kinds of training. I would say that a lot of the trauma-specific trainings that you can take, like EMDR and thought field therapy and different body works, but American Psychiatric Association say. So this is really kind of a grassroots practitioners movement. And this is what Barry and I have been seeing, is that people are just kind of like tired of the old way, and they just start doing it in their own way, in a way that they believe is more effective. And the reason that they do that is because they have a conscience, and they realize that they can't continue to practice something that they see isn't working. So we're really encouraging all of you to think about how can you change what you're doing into this healing paradigm. How can you become a transformer rather than the lady with the Band-Aids or the guy with the Band-Aids?
For more information about trauma and its effects and how to heal trauma, please visit traumainformedcaretraining.com.